We at OrthoHub are excited to be hosting this global webinar with the International Orthopaedic Diversity Alliance. We have many shared goals, so it's a privilege to be partnering up today. Many of you are new to OrthoHub, so just briefly, you can find us online at www.orthohub.xyz, where our goal is to provide freely accessible interactive orthopaedic education for all. We are across all the social media platforms, so please do follow us there and do subscribe to our YouTube channel. There's quite a lot of brand new video content.
We'll proceed on now. I'd like to introduce my colleague, Andrew Weins. Andrew has been really prominent in promoting diversity in Australia in our Orthopedic Association, and he's currently on the board of the AOA. Thank you, Andrew, for joining us.
So a little bit about the Australian Orthopaedic Association. So Australia is a big country, but a small population. We've only got 25 million people, but we've got 20 million kangaroos. We're a very multicultural country, and our First Nations people have been here for over 60,000 years. The Australian Orthopaedic Association has 1,300 members, just over 200 trainees with a national training program. At present, we have 5% female orthopaedic surgeons, and our female trainees are 15% of the total trainee body.
Similar to particularly the US, we've had an experience of having over 50% medical graduates being female for at least 20 years. And as you can see, it's been a fairly flatline curve of women engaging and training into orthopaedics over that time. And this was one of the stimuli for the Orthopedic Association to develop our diversity strategy.
Why is diversity important? Well, it's important on a number of different factors. And a paper from McKinsey, the management consultants, showed that organisations with at least 30% diversity tended to attract the very best talent. They were the most innovative, and they were the best at making appropriate decisions.
In addition to this, diversity as a healthcare worker is even more important for our communities, because there's strong evidence that communities that have greater diversity in their workforce also have decreased issues with healthcare inequity.
What have we found are the greatest barriers to diversity? Well, they include the lack of appropriate and visible role models, unconscious bias in reporting, in selection and in promotion, and a lack of flexible working options.
In 2018, our then all-male Australian Orthopaedic Board invited the women of our association to collaborate on designing a diversity strategy focused on increasing the inclusion of women in orthopaedics in Australia.
And the vision of the association was to create a culture of inclusion that promoted and enables all people into and within the profession of orthopaedic surgery to the benefit of the Australian people. And there were three core strategies: culture and leadership, advocacy and engagement, and inflexibility.
And the importance of leadership when you're running a diversity strategy really can't be underestimated. It has been shown to drive the foremost effective diversity initiatives, including communicating and embedding values, driving unbiased selection and promotion, supporting men and women with family responsibilities, and providing a very visible and committed leadership team.
Each aspect of the strategy has specific aims. For example, the aims in culture and leadership are to remove diversity and equality barriers and create an enabling environment, to deliver sessions in education, training and ethical decision-making in leadership, to mentor and support women to leadership positions, to benchmark against well-recognised best practice, and to create an environment of psychological safety.
So rather than just having a strategy with some ideas, this is a strategy that has a report card and a lot of deliverables. And as you can see, we're slowly working through these, and this strategy will be reviewed at the 5-year mark and revisited.
There's no doubt that leadership is absolutely crucial in diversity. and it's been the board that has been a critical driver of our diversity strategy. Currently, 30% of the board are female, though there's only 5% of the membership, and women across the membership, across the leadership positions and committees in the Australian Orthopaedic Association now hold 16% of the roles.
So advocacy and engagement have been achieved through many measures.
And we've done our absolute best to visibly promote active, positive role models, both male and female, at events for particularly junior orthopaedic surgeons.
In our scientific meetings, we have established a new policy to increase visibility and inclusion of women as panel members, guest speakers and session chairs. We now have a permanent female representative on our continuing orthopaedic education committee, and we also provide breastfeeding rooms and childcare services at all AOA meetings.
We have a quarterly diversity e-newsletter that goes out to all members, exploring various aspects of diversity, and the most popular article of all has been from a male colleague who shares parenting and work with his physician wife.
We have done a lot of research on the data from our trainee selection process, and we know that there is a degree of gender bias in the first stage of our selection, which involves producing a CV and a reference. But in our second stage, which is our interview process, a series of 8 mini interview panels with 3 panel members on each interview, has been shown to be non-gender biased. And this has affected our selection now. We have decided to increase the number of applicants we interview to decrease our bias. So we've gone from 25% now up to 80%. And over the last 4 years, we've had 40 to 50% female viewers compared to an average of 11% for the previous decade.
One of our most successful strategies has to been run workshops for medical students and junior doctors, where they've been exposed to a number of male and female role models, and where some of the myths surrounding orthopaedics, such as it being a boys' club, can be debunked.
We've increased our flexibility in training by moving from a time-based curriculum to a competency-based curriculum. This allows our trainees a lot more flexibility in whether they stop and start training at various intervals. We've also introduced flexible training posts for our trainees as well, and they are truly flexible, so they are negotiated by the trainee and the employer of the hospital and the staff that they're working with.
We have 3 diversity committees at the Australian Orthopaedic Association. The OUR committee is at the forefront of gender diversity. We've found that committees focused on gender diversity are more effective with both male and female leaders involved in the process. As a result, OUR has several senior male members who hold leadership roles in the association and hold the power to affect change.
And because we only have 5% female AOA members, we have also developed what we call the AOA Champions of Change group, and this is a male state representative from each state, and these are nominated by the state committees. And these colleagues advocate for diversity on a large number of committees. They sit on the state committee, they sit on regional training committees, and they're of great value because we just do not have enough women to go around, and there are many committees that do not have a female, and so we're very grateful for the men who step into these roles and advocate in the absence of women. As you may have noticed also that there are a couple of women, including myself, on this committee, and all our committees are diverse now and as wherever possible. And we know from evidence that men and women working together in diversity is a much more successful program for gender diversity.
As home to the world's oldest continuous culture and 270 other cultures, Australia is one of the most multicultural nations on the earth. We've now started working towards a cultural inclusion strategy. We will soon graduate our first Indigenous orthopaedic surgeon and are very keen to create a visible pathway for our First Nations people to create a more inclusive environment for our many members of diverse cultural background.
So in conclusion, we know that diverse health workforces improve healthcare inequities.
We know that diverse organisations attract the very top talent, increased innovation, and are better decision makers.
So finally, the pathway to diversity is increasing visible role models, minimising unconscious bias, and increasing flexibility. Thank you. And thanks, Andrew.
Thank you very much.
Thank you, Jenny and Andrew. I think we've got a question from Mari Thiat, who wants to know, regarding the flexible working hours for trainees, how did you get buy-in from hospitals?
Did you want to answer that, Andrew? Or?
Yes, so we made it non-optional. So each of the bigger hospitals with 3 or more accredited trainees had to come up with a program that enabled flexible working hours, shared jobs, those types of things. So it was a condition of that hospital being registered by the Australian Orthopaedic Association.
So if you don't agree to it, you don't get a trainee.
That's tough but effective, I suspect. So that's a really good lesson for us to take on board, perhaps in the UK and across the world. Right, let's just see if we've got any other questions. I've got a question just on mentorship. So do you think a female mentor for another female trainee is better or worse than a male mentor, or do you think it just doesn't make any difference?
Andrew?
I think both are important, and I think both have different roles. Certainly, as a male, in a male dominated association at the moment, I think males can be very valuable in assisting particularly the younger members and the trainees in establishing themselves in the association. But I absolutely think, and we certainly see this at the AOA workshops, that it's really, really important for the junior female doctors to see female orthopaedic surgeons working, juggling work-life commitment, families, having kids, being on call. So it's absolutely vital that there's a female representation as well. But I think both are important.
I would agree with Andrew's comment. I'd also say that the young women who've come to our workshops have been really strongly impressed by the presence of men teaching them there. We've had a lot of positive feedback about that. They feel like they're being welcomed into the organisation because it's not just women welcoming them in. We've had our vice presidents and presidents welcoming these young women at these events. And so they feel that the whole organisation is welcoming them. And I agree with Andrew. I think men and women are very important, both of them. But one thing I would say, often the men are in positions of power where they have great opportunities for sponsorship, not just mentorship. And I think that's important as well.
Jenny, I think that's a great point regarding sponsorship and supporting female trainees so that they take on leadership roles as well. Thank you.